balance class, everybody. Today we're talking about the third sense of balance, which is the inner ear. So I'm standing in front of my poster that I use for education here at the office in my treatment room. This is where I spend the majority of my day, and the majority of my day is spent working with balance patients, particularly on inner ear dysfunction. So what in the world does the inner ear do? So people think ear and they often think hearing. That is not my gig. The hearing center and the balance center are close neighbors in the inner ear section. So just inside the skull, past the eardrum. Okay, so way, way deep inside of our skull, microscopic, we have the balance center, which is right next door to the hearing center. We have a right and a left inner ear. And they should work, hopefully, at a symmetrical strength so that we stay balanced, just like engines on a plane. When one inner ear, or balance center, not hearing, is not working as well as the other, that asymmetry can cause us to feel a little off. Common symptoms of inner ear dysfunction include feeling foggy-headed, big-headed, feel like if you move your head too quickly, you feel dizzy, right? Dizzy is one of those broad terms that can mean a lot of things. It can mean lightheaded to some people. It can mean off balance to other people. It can be perceived, because it is a sense, it can be perceived as difficulty focusing, feeling disoriented, versus vertigo, which is by definition, a false sense of movement. Doesn't necessarily have to be a spin. It can be a wave sensation. It could feel like you just got off a boat. All of these descriptions and more are what I hear for people that have inner ear dysfunction. I'm going to admit to you, I have an inner ear dysfunction. I have BPV. It's something we're going to talk about in future. No matter what, Meniere's disease, BPV, maybe there's no name for it. These are things that we work on here in the clinic that I'm going to try to share some information with you on, because I really feel like this is a silent epidemic, that a lot of people are running around with inner ear problems, don't even know that they have them, undiagnosed, and certainly untreated. There are some medications that are used for this, but by and large they are suppressants, which means they slow the system down, and if there is a dysfunction, slowing the system down won't help fix it. It may be, in my opinion, a temporary band-aid. Sometimes that band-aid's necessary. If you are so dizzy or the room is spinning, you've got such bad vertigo that you're vomiting, medication may be in order for you. My job is to help you and my patients figure out how to help solve the problem if possible, or at very least work around the problem so that your quality of life, your function is where you want it to be. And it needs to be for your safety. So things that stimulate the inner ear: neck motion. When I am super dizzy with my vertigo, you couldn't pay me to move my head. I walk around, I touch things like we talked about in the last class, because my sense through my inner ears is not where one of them is not working properly. So I need to rely very heavily on my visual system. I keep my head still, I focus on things, and I touch a lot, okay? Because my third sense is my inner ear is not working real well. Right now I'm fine, thank goodness. As fine as I get anyway. So neck motion stimulates the inner ear. So people will often say, well, I got dizzy, but it's because I moved too quickly. That can be related to blood pressure, particularly if it's when we get up or out of bed. But if it's just turning to get something, that's a little red flag that perhaps that might be a problem with the inner ear. So there's really cool reflexes between the eyes and the inner ear. If you've ever had vestibular, which is the medical term for inner ear, if you've ever had vestibular rehab, You may recall that the person working with you looks at your eyes a lot. The eyes are the window to the inner ear. We can't see this part of the inner ear. When I evaluate a patient, I can't see beyond their skull and their eardrum. You don't want me to. But I do look at eyes. Eyes tell us a lot about what the brain is doing, what the inner ear is doing. Think about even just watching a medical show on TV. Someone comes in with a trauma. One of the first things they do is they look at eye responses, movement, pupil dilation, all that good stuff. So the eyes and the ears work together, which is why busy environments can be quite disturbing for someone who has an inner ear problem. We like to keep things quiet and simple. We don't want a lot of sensory barrage. Anytime we move our head from this position, so we particularly, if we break the plane of gravity, that's harder on the inner ear. The inner ear detects head motion, so moving forward in a car. If you've got a history of motion sickness, to you, it may seem like the trees on the interstate are going backward when in fact you know that you and your vehicle are moving forward, but there's a mix match of sensory information where it looks like one thing feels like another. Or when the car at the stoplight next to you rolls backward and you press on the brake because you feel like you're moving, that's a little inner ear trick or a brain inner ear not really communicating the way it should be. So it's a super complex system. I don't expect you to know the stuff. I've spent almost 30 years working on this stuff. I am a patient, so I understand it from a professional and a patient perspective. Don't expect you guys to know all this stuff. I don't expect that you're going to know everything from just listening to these videos, but I want you to know that those are some of the things that are red flags that might make it worthwhile for you to pursue further with a specialist, with an ENT, with an audiologist, with a vestibular physical therapist. Because here's one of the things you need to know. I went to school 30 years ago. We didn't even get taught this stuff. I had to go and get special training for it. Most PTs that I'm aware of right now get very little bit of this in school. So this is definitely a specialty. It's not for everyone. And just know that if you really want to get value out of your provider, just like with any other medical issue you may have, or even just you're looking for a car, you're looking for a new cell phone, you go to the person that knows best. This is no different. We will get into depth with the inner ear, but this is just a little basic information. Hope that you found it valuable. And as always, be well and have a great day.